Welcome to Medicare Madness, the basics of Medicare supplement plans. You have two ways to supplement your Medicare coverage. You can stay with original Medicare, Part A and Part B, and then you can buy what's called a Medicare supplement or a Medigap plan, which helps supplement the out-of-pocket cost under Part A and Part B. You would then add a Medicare prescription drug plan to round out your coverage. The other option is to enroll in a Medicare Advantage plan. These plans combine Medicare Part A, Part B, and Part D all under one plan. Then you can also add in a hospital indemnity plan to help cover the out-of-pocket cost under the Advantage plans. Today we are going to focus on the Medicare supplement or Medigap policies. Medicare supplement plans help cover the gaps that are in an original Medicare Part A and Part B. You must be enrolled in Part A and B to be eligible to buy a Medicare supplement policy. These policies cover only one person, so you, and if you have a spouse or a partner, that other person will have to buy their own Medicare supplement policy. Each Medigap or supplement policy is standardized by the federal government. So what this means is that plans with the same letters must provide identical coverage. Here is a chart of the different Medicare supplement plans. They go from A through N. Some plans have been discontinued over the years. On the left-hand side, you have all of the out-of-pocket cost under Medicare Part A and B. And then in each row under the letter, you have shown what that lettered plan covers. So if we focus on the middle plan there, Plan F, you can see that Plan F covers all the out-of-pockets under Medicare Part A and B at 100% until you get down to the foreign travel emergency. No plan covers more than 80%, and this is after a small deductible, and the maximum payout is up to $50,000. Now Plan F and Plan C both cover the Part B deductible, and that's important because we will talk about these plans later in the presentation. Plan G is the next step down. It covers every out-of-pocket cost under Part A and B except for the Part B deductible. In 2020, that deductible is $198. So Plans C, F, and G are probably the most popular options at this point. Now, while the benefits under the different plans do not change based on that lettered plan, the premiums will vary between companies, and the price is typically based on your age, your gender, and also your zip code. Now, going into a Medicare supplement policy, you are typically paying a higher monthly premium compared to a Medicare Advantage plan to have low or no out-of-pocket costs for your services. The other benefit is that the Medicare supplement policies do not have any network restrictions. So you can see any provider in the United States that accepts Medicare and is willing to see you. So the strategy of going into a Medicare supplement plan is because you want lower out-of-pocket costs when you go for services, and you would like to have no network restrictions. When someone first turns 65 and goes on Medicare, or the first time someone enrolls in Medicare Part B, you have a 6-month open enrollment period to enroll in any lettered plan without any medical underwriting or pre-existing condition exclusions. Then going forward from that point, there is no annual enrollment period for these supplement plans. So what that means is you can change these plans anytime during the year, but you have to go through medical underwriting to see if you're approved to go into that plan that you want to go into. Now, there are other times where someone could be eligible to get into another plan without any medical underwriting. Those are called guaranteed issue. Examples would be loss of employer coverage, termination of a Medicare Advantage plan that you're in, or if you move out of the service area of that Medicare Advantage plan. Now, if you do want to change your supplement plan during the year, you would apply to another company, and they would typically either accept or reject your application, or sometimes they can accept your application at a higher rate, and that is all based on your individual health history. Now, the plan that you're enrolled in can never kick you out and can never increase your premium based on your specific health conditions. Now, back in 2015, Congress passed legislation that beginning January 1st of 2020, anyone turning 65 would not be eligible to enroll in Plan F or Plan C. Plan F and Plan C provide 100% coverage for the Part B deductible. I have $185 here. That is since adjusted to $198 in 2020. The theory behind this change was that they thought that if they required Medicare beneficiaries to have some more skin in the game, overall Medicare spending would decrease. So that was the basis of why Congress passed this legislation. So it's important to understand your plan. For the supplement plans, the premiums can change each year. Typically, they will go up each year. The benefits of that plan will not change, just the premiums. If you are in a supplement plan, you would have a prescription drug plan to cover your prescriptions. Those plans, the formulary and the coverage for your prescriptions can change each year. So it's critical to review your plan every year to see how it affects you. Contact information is included for Social Security and Medicare. And my name is John Ebersol. I'm an independent Medicare advisor. My website is medicaremadness.com. You can email me at john@medicaremadness.com. You can call or text at 717-798-1603. And I'm independent, so with the Medicare supplement plans, I can contract with all the different companies to help find the best pricing for you. If you are enrolling in Medicare at 65 or just leaving employer coverage, I can help you go through the whole process to enroll Medicare and select a plan. And if you're currently on Medicare, I can help you evaluate your current options. There's never any charge for my service. So I look forward to talking to you, and have a wonderful day.